Here I find myself in the business section, so I am going to focus very much on the Food for Life Catering Mark as a carrot for the catering industry. And I just must, though, say a few words first about the Food for Life partnership to preempt any potential confusion, because the Food for Life partnership is the wider context, if you like. The Soil Association links up with the Royal Society of Public Health, Garden Organic, Focus on Food, the Health Education Trust, increasingly with more local partners, to deliver a programme which is about transformation of food culture. And we are lucky enough to have a lot of public health funding now, local commissions coming in behind the lottery funding that we've had over a number of years. That's very much the wider context, and we've been able to demonstrate the impact on dietary habits, increasing consumption of fibre a day from children once they start cooking, growing food, linking with farms. So that's the hugely important wider context and very closely linked with the school food plan. But what I'm here today to talk about is the catering mark, which is a central plank of that. It's an assurance scheme for caterers that the Soil Association launched back in 2009. And at the time, it was quite a big, bold step for the Soil Association because it has 3 levels: bronze, silver and gold. And bronze doesn't feature organic at all. And there were a few people at the time who were uncomfortable with that. There are a few people still who are uncomfortable with that. But it was part of a determination to make change happen at scale, to go from niche to mainstream, to give stepping stones, if you like, for change, and to create new social norms, going back to the challenge that Jenny set out this morning. If you can change the food that is on offer, that is on the menu in all these settings where we all live out our daily lives, from nurseries through schools, hospitals, workplaces, care homes increasingly. If you can change the food on offer in the places where people eat together as well, you can really change social norms. And that was where we were coming from with the catering mark. I said that the bronze level doesn't feature organic. That doesn't mean that it's not seriously challenging for a lot of what we call cost sector caterers dealing with very tight budgets, who often, certainly back in 2009, didn't know a lot about what was happening in their supply chains, certainly in terms of where food was coming from and what production standards it was meeting. So there are some big ones in here still. The bronze, Food for Life bronze standards, the requirement to meet the relevant national nutrition standards for the sector, whether those be mandatory, like the school food standards, now new standards for hospital food, and the catering mark verifies compliance, or whether they be voluntary standards like the all-important voluntary food and drink guidelines for the early years sector, which are only voluntary, and the catering mark is out there, again, giving an incentive for compliance and verifying that. But also hugely challenging the requirement for all meat to be traceable and farm assured to at least UK welfare standards. I'm afraid to say that, particularly in the NHS, that's still a huge hurdle for a lot of potential applicants to the catering mark, and a huge dependence on imported meat in the supply chain. 75% of meals being freshly prepared from minimally processed foods. And maybe we should go and set up in Brazil from what we heard this morning. But still, we've turned a hugely important policy corner in terms of school food with that change of policy heart. No longer are we losing kitchens to IT suites. In fact, we're seeing kitchens being reinstated in schools, but we're not there with hospitals, certainly. So then if the bronze Food for Life catering mark is about fixed standards that remove the worst offending items, if you like, silver and gold is a point system, and it's supposed to be about promoting the best and improving the rest and giving an incentive for every bit of change. And it does drive very real change because those points are linked to percentage spend on different types of higher level environment, welfare standards. There's a requirement, for instance, at Gold that 5% of your total ingredient spend has to be on free-range meat, for instance. Also, a vehicle for the all-important Eat Less Meat agenda, which we were determined to take on. So there is a built-in incentive, a hefty allocation of points for meat-free days, for replacing meat on the menu with alternative forms of protein. One of the recent gold achievers, the University of the Arts, provided by Baxter Story. So across Central St Martin's, Camberwell College of Art, London College of Fashion, to achieve their Catering Mark goal, they introduced meat-free Wednesdays. They replaced a lot of meat on the menu with lentils, for instance. And championing local food producers, the third category. And we have a Food for Life supplier, Catering Mark supplier scheme too, which provides a route to market. There is a £3 local return on investment for every pound invested in a Catering Mark menu, and it is largely in the form of increased opportunities for local food businesses. And that's a really big driver for local authorities as procurers and NHS trusts as well. So I'm delighted to be able to strike a positive note today with the news that we've hit quite a big landmark in terms of scale with the Food for Life Catering Mark. And as of this week, fortuitously, we're now having more than 1 million meals a day being served to Food for Life Catering Mark standards. So when I think back to 2009 and the 5 schools that thought they were probably achieving the standards, this is really big headway. And we are seeing some of the sums. It means tens of millions of pounds being spent each year on some of these high-level environmental and welfare schemes, which is great to see. And it started out very much with school catering. It's now more than 25% of school catering covered by the Catering Mark standards. So it's great to see that becoming an industry norm. But as I said, it's cradle to care home, if you like, with the UK's largest chain of nurseries, Busy Bees, has achieved the Silver Catering Mark. More than 30% of universities have outlets that are Catering Mark certified. Visitor attractions, the RSPB and National Trust rolling this out. The current chair of the Catering Mark Standards Committee, because the standards are governed by an independent standards committee, is Dr. Abby Burns from the RSPB. The outgoing chair was Rebecca Spate from the National Trust. So great to see them involved as opinion leaders and caterers in their own right. And workplaces as well. We loved getting some of the iconic workplaces coming into the fold, like DEFRA itself, eating Catering Mark menus, Department for Education, City Hall, Scottish Government, PepsiCo, a variety of big major employers as well, and care homes, so important. The Food for Life Catering Mark verifies compliance with the Caroline Walker Trust and National Association of Care Catering nutrition guidelines in care homes, as well as all the wider standards. HC1 is a major care home provider. It took on a lot of the Southern Cross homes, and they have already rolled out the Catering Mark to 150 care homes and are going to roll it out to a further 100 in the next year. And one of the most encouraging things for me, going back to that difficult decision about bronze and do we put organic at bronze, and we've got now over 40, it says 45%, 47% of Catering Mark meals are at silver and gold levels. So the stepping stones really do work, which is really fantastic to see. And in London, it seems to work even better with 2/3 of Catering Mark meals at silver or gold. And we are feeling positive for the 2nd million, if it's not too ambitious to say, because partly because of the impact of universal infant free school meals, which has in many cases nearly doubled the take-up of school meals, and that hasn't been factored into any of the Catering Mark calculations yet. But also because we are seeing a newly supportive attitude from government. The balanced scorecard, which came out of Dr. Peter Bonfield's plan for public procurement, a very useful, valuable attempt to create a framework for procurers where quality trumps price rather than the alarming trend in the opposite direction. And very clear read across for the Catering Mark, guaranteeing a good or excellent score within that balanced scorecard. Mandatory in central government, but strongly encouraged across the wider public sector. And David Laws, the schools minister, has laid down the challenge for wanting to see all schools and caterers working towards a quality award like the Catering Mark, again on the back of the fantastic policy that was universal infant free school meals. And the new school food standards do very clearly champion fresh, sustainable and locally sourced, ideally from the school's own garden, and those are coming into place in January of next year. I was on the Department of Health Hospital Food Standards panel. It was an interesting place to be with some lively debates, not least about kitchens in hospitals. But thanks, credit must go to Sustain and Lady Cumberledge's bill. We have mandatory standards from next year. The government buying standards have become mandatory in hospitals, which is a good starting point. And again, the catering mark is verifying those, but also a ladder to excellence. And we're delighted to see trusts like Bart's, the largest NHS trust in the country, specifying catering mark gold across all 6 of their hospitals in a contract that will be one of the biggest of its kind. So things really moving on. And if you want to think about something you can do and policy levers that are there to be pulled, we work with the Department of Health to introduce a new, have NHS England introduce a new sequin. If you haven't heard of a sequin, hands up who's heard of a sequin. It's good, it's growing awareness. Normally a lot of puzzled faces. It stands CQUIN, it stands for Commissioning for Quality and Innovation. And it means basically that your local GP commissioning groups can link a proportion of their local hospital's budget to improving hospital food and to achieving a benchmark like the catering mark. And so obviously we would urge as many of you to make your GP commissioners and local hospitals aware of that and taking up that opportunity. So just finally to say, although the catering mark provides a framework, provides an incentive and a verification tool, it's lovely for us to take credit for all the numbers. But every one of those caterers, every one of those schools, hospitals, etc., represents a huge achievement, often by a few really passionate individuals making it happen. So as Jamie Oliver said, here's to the next million, and congratulations to all those who have been involved.